Hello again. Now, there's a growing concern over the spike in the number of deaths from other conditions in the country. While we are not out of the woods completely from the Covid-19 pandemic, a new report shows that there has been an increase in deaths from heart and nervous system related conditions and cancer. Well, let's unpack this now with Guy Chennells, the head of product at Discovery Employee Benefits. Guy, good afternoon. Welcome to today here on ENCA. Thank you very much for your time. So tell us, what is your data telling you? What have you found?
And we found some interesting things. Firstly, if I can just explain what the data is, we have a product that covers life insurance for employees of employers. The employer buys it on behalf of the employees, so it covers lots of people. They are not underwritten, so they don't go through medical underwriting before they enter that product for the most part. And so it basically is representative of employed South Africans who have chosen Discovery as an insurance provider. What we can do as well, though, is we can overlap that data with what we know about people who are also on our medical aid, and that gives us the ability to determine to quite a high degree of accuracy the reason for someone dying. Which is otherwise difficult in South Africa because you may know that death certificates usually do not give a reason for death. So we track that annually, and this year we had some very surprising results. I say very surprising. They are stark results, but we had been warning for some time to expect these kinds of trends because of some of the warning signs we're seeing before. And you summarized them. We're seeing a serious spike in deaths due to cardio, metabolic type conditions, as well as cancers and some others. On unnatural deaths, we see an increase in crime-related deaths, deaths due to suicides. So we're seeing some concerning movements there.
Yeah, is it because people didn't have access during the 2-year lockdown period to make sure that they look after themselves? If you're seeing, for example, deaths from issues around cardiology and stuff like that, what is it? What are you seeing has been the largest contributor?
Yeah, it's an excellent question. I must say that we don't have all the answers. We can join some dots. We can't draw a straight line. The dots that we can join are the things that we've been able to observe. We've been able to observe that during the COVID period, many people were exposed to the virus. And there have been other studies internationally linking the virus to development of conditions coming out of that. In fact, even locally, Discovery Health Medical Scheme released some findings earlier this year linking exposure to COVID to developing diabetes and cardiac type conditions later. But at that stage, they did not identify an increase in mortality. The other thing we're able to identify that we were concerned about early on during the pandemic is that people, for the most part, stopped doing the regular health checks that would enable someone to pick up some of the key risk factors leading to acute cardiac outcomes. So if you go for a regular health check, you'll pick up things like your cholesterol level, your blood pressure level, and those are the kinds of things that are not directly observable. Cholesterol in particular is called the silent killer because you can't see it until one day, it emerges as a heart attack. And so those levels dropped by 50% during the pandemic, and still today are not back up to the levels that they were prior to the pandemic. We saw the same thing in cancer screening. So people just going for regular screenings to pick up whether they have cancer, and a concomitant decrease in the levels of cancer treatment versus the trend line that we would expect to see on Discovery Health Medical Scheme. We also saw a drop in exercise levels as far as we can track exercise during the pandemic. That has largely been restored post the pandemic. But certainly there was a period of decreased activity, which again is a risk factor for cardio-metabolic type conditions. And of course, we know from our own experience and from various studies that people have been under enormous stress and pressure over the last 2 years. That has knock-on impact into one's well-being.
Yeah, I don't know
So a
if
number of kind of headwinds on people's health.
Yeah, and I don't know if it's going to improve anytime soon, because the other types of diseases, like, for example, Guy, measles. We are now seeing outbreaks of measles, not just in South Africa, but across the world, as warned by the WHO just the other day, because during the pandemic time, many families could not access health services to immunize the babies in terms of measles. Now we are dealing with outbreaks. That's why I'm saying things are really might get worse. So is it in your purview to, when you're dealing with your clients in the employee benefit space, because you said it's groups of people, is it in your purview when you're dealing with your clients to make them aware of these trends and therefore assisting them or enable them to encourage their employees to take better care of their health?
Yes, that's a great point. Yeah, we have some ability to do that. And employers have a very pivotal role in all of this. You know, they really do hold a position in the lives of their employees that is unique, and to some degree are able to drive awareness campaigns and even encourage and make it easy for their employees to do things like a regular wellness check or even cancer screenings. We encourage that through communications. We also, in our product design, we actually return some of your premium to individuals who are members of Discovery Health and members of our group life insurance product if they've gone for this Vitality Health check. So we try to encourage it both through awareness, it's in people's self-interest, but also by putting our money where our mouth is. We're willing to reward people for doing it because it is such a pivotal health behavior. It is the sort of number one pivotal health behavior, to know your health status on some of these key risk factors.
Yeah, no, thank you very much for your time and explanations here this afternoon on Today. That's Guy Chennells, Head of Product at Discovery Employee Benefits.